My name is Helen Newstead and I'm currently studying adult nursing at London South Bank University. The teaching and the facilities here are really high tech, like the lecturers really know their stuff. It's very exciting how they're still able to teach us but still practice themselves. I think that's really important, especially when medicine is ever changing. So we're just doing pulse.
Within learning disability nursing, people come from a range of backgrounds. There's students who've worked as support workers before, or older students with families who come onto the programme. There's also students who are coming from A-levels but might have family experiences with a learning disability. So we really get a range of people with all sorts of experiences. But if you're enthusiastic about learning disability nursing and you've got a real passion for people with learning disabilities, then this is really the programme for you.
The teaching here is amazing. I mean, we get so many extra speakers in and specialists, so we not only get our lecturers, but our lecturers know, oh, there's a specialist in this area, and then they get them in, which is amazing because we get the right information from the right people. The facilities, like we basically have a fake hospital in our university. It's amazing, and we have a sim man and a sim junior, and I just think practicing on them, it's just that experience is just priceless. I mean, that's as close as you're going to get to real life before you actually get real life.
My name is Nana Osai-Mensa and I'm studying midwifery. I've just come to the skills lab to come and learn how to attach babies and teach mothers how to hand express. So we come here, we practice with the dolls and we practice with the knitted breast, and then we just get a bit more confidence about breastfeeding so we can help the mothers.
Throughout the either 2, 3 or 4 years, students go through what we call the occupational therapy process. Over that time they are in classes for a period of time, but they also are doing clinical work. And over the 2, 3 or 4 years, it is 4 placements, which is equivalent to about 1,200 hours of clinical time in various sites all around London and southern England.
Diagnostic radiography, it involves taking x-rays of patients. The course it evolves around anatomy and physics, and it's quite enjoyable, it's quite interesting. If you want to study at a university that is renowned for its education in terms of healthcare, I think London South Bank is the place.
We have a virtual laboratory in which we enable our students to practice setups of patients on linear accelerators, similar to what they would experience in the clinical department. During these setups, students become comfortable in using the clinical equipment. We also have an additional treatment planning suite in which students can learn practice skills to become competent practitioners in the clinical department. And when they complete their degree, they are eligible to register with the Health Professions Council as therapeutic radiographers.
Well, one of the unique features of this program is we have lecturers both from the UK and also from China. Things I'd recommend about the program are the excellence in teaching, the facilities we have in this K2 building, which is lovely and new and everything works. The relationship that we have with the Confucius Institute, which means we have the variety of lecturers and the experiences that they bring.
Placements that I did have really helped me in my career path. I've always been interested in mental health, and the placements that I was being sent to were acute wards, psychiatric intensive care units, and also in the community. I completed my course this year, went through the interview process, and I'm working as a mental health social worker in a community mental health team.
I would definitely recommend studying social work at South Bank because the health and social care faculty has a really good reputation here, and a lot of the lecturers have a lot of credibility. They've published a lot of journals and books, and South Bank tends to be very respected among other people I've met.
Bursaries that were afforded and the funding is definitely vital to what we do here. If I didn't have the bursary, I wouldn't be the student I am now. I chose London South Bank because it's one of the best for nursing, and I think the fact it's so closely connected with some of the best hospitals in London, like UCLH, St Thomas and St Guy's, is a real selling point. I mean, if you get to work at these hospitals, you're going to experience lots of different things.
100% recommend London South Bank University to other nursing students because the experience you get is just phenomenal.
London South Bank did transform my life. Throughout the 3 years that I was studying here, I was learning a lot, developing myself personally and professionally, and indeed, I'll agree, it did change my life.